Well, here we are again. We're live. It's kind of we were trying to do this monthly, Leanne. We kind of it's summer.
Yeah.
It's been a little bit, but we're back on a Friday, and it's good to see you.
Yes.
Where are you? I see some nice kids art in the back.
I am.
Or
I am in Baton Rouge, Louisiana today. I am babysitting grandkids for the weekend. So
all
this is
right.
the start of my day here,
Well, yeah, it's definitely the start of my day.
and
I'm on the way to.
I'm in the kids' playroom. So yes, you're seeing their artwork from years back behind me.
That's great. I never quite got to do that as neatly as your kids and your grandkids did. But you know, we normally pick a topic for Nutrition Friday or occasionally Nutrition Wednesday. But there's been a couple of conferences around over the last 2 months that have had nutritionists on and not necessarily gotten to some of the questions, and there's some lingering questions out in the community, and so thought we'd take a stab at some of those answers, though, answer those types of questions, see if more come in, and we'll go from there. So I'm going to add the questions real quick, and I'm going to put you on top because I'm not the one answering. But, we get this a lot, whether there's a special diet for net patients and what foods to avoid. You'll see even farther down at the bottom for the latest questions, are there foods that you should limit? And are there foods that might help with this cancer? But let's just start with special diet for net patients.
Okay, that sounds a great place to start. To start, actually. So, is there one set diet for neuroendocrine tumors? And I guess the best answer is no, not really. Everybody is individual, and these tumors are very different. So, we the diets that you really want are just the meal plans. I refer to them more as meal plans than diets, but that you want to follow really are going to be based on your symptoms and overexpression of some hormones or some enzymes or something that's causing those symptoms, and also controlling management of other things, the comorbidities that you may have, diabetes, hypertension, and things like that. With that being said, we do know through some of the research that has come through over the last, I guess, 5 to 10 years, some of it out of Europe that's really, and Italy that has really looked into more into intakes, have a little bit better control over their intake studies than we do here in the States. And it does suggest, excuse me, it does suggest that the plant-based Mediterranean diet type of thing is probably an overall wellness and things like that. It's probably still a real sound nutritional base to work from for just that everybody's used to or more familiar with. Again, that has to be adapted to what you tolerate and some of the symptoms that we see as well. We know that we're trying to just overall eat a little bit more, well, quite a bit more than some of us, especially here in South Louisiana, a plant-based diet that's lower in fat, lower in sodium, lower in concentrated sweets and sugars. And this is for glucose control and secondary causes of problems with oncology treatments and different types of cancers. So I guess, and then foods to avoid. Well, there's some things that we think that overall for all wellness, not necessarily for patients that have already had tumors, but just for everybody, is that there's some foods that we just want to reduce intake because we know that there's an increased risk of possibilities of increasing risk of cancers. And these are alcohol, processed meats, deli meats, foods that have been cooked at real high temperatures, grilling over flames, frying in a pan where you really overcook or to the darker burn. Those cause heterocycle amines, HCAs, and other carcinogens. So those are some of the things that we really want to concentrate on avoiding. Most things we do in moderation. There's some things that we don't want to get excesses of. And we'll talk a little bit more about some of those as we go through today, because there's a couple of the people's questions that we'll discuss those as well. Hang on one second. Let me see if I have a few notes. Let me see if I got to all of them that I wanted to say. There was we know that there's some things. I get the questions sometimes about specifics, and somebody asked the nut question, but some of the dairy. Okay. Sometimes dairy and prostate cancer has been questioned. And again, it's an overconsumption beyond what the limits of, 2 dairies a day. But for some people that research is not been necessarily confirmed, but suspicious. And so we kind of put them in that. But it's mostly in the prostate cancers. And really that is really related to fat. If it was a low fat or a skim milk, it didn't have the effect as the high fat regular, whole milk does. So some of it may be a fat associated with some of the fat content with it as well. So those are some of the things that we really that we know through research are really suggestive of having some possible increase. Peanut butter was questioned. Am I to that question yet? I may not be.
No, I think we'll get to the nut butters and things like that. So. But one of the questions, of course, with special diets and foods to avoid is that, there's a good percentage of us who are on somatostatin analogs, and the challenges with whether it's high fat food or using Creon. How does that all play into the diet as well?
So it does, and that's a very important part. So many times the foods that we want you, and really foods to avoid, I can go much further with that as well. I was just doing some general there, but depending on symptoms in particular. But we know that the medications that we use for treatment can block the enzymes, the amount of enzymes that we have for digesting foods. Overall, these are pancreatic enzymes. Fat, the enzyme that digests fat is lipase. And when we block the overexpression of hormones by using the medications, the analog, I just went blank.
Somatostatin analogs, lanreotide, and sandostatin.
Yes, sandostatin. I was going to call it a name. When we use these, we're blocking that overexpression. And when we block that, we also block some of these expression of these enzymes that we want, and that can cause these symptoms. So in people that are having fat malabsorption, and they're usually identified by the stool can be kind of oily, greasy, floaty, real foul. And that means you're not getting those fats digested, because sometimes you can even see the droplets. Using pancreatic enzymes, which we can give by medication orders by physicians at levels that are high enough to help give you the lipase that you need to digest those fats. So there are some over-the-counter ones, but they don't tend to have the amount of lipase that we're looking for when we really have problems with the absorption of the fats. And the reason you can get some fat malabsorption in long term, if you did not make this adjustment, but there's some really malnutrition, and you need these calorie sources as well. So we don't want people to become malnourished. And so many times we use these pancreatic enzymes to help you digest the fats and get those nutrients that we need you to consume, so that we can maintain your weight and keep you from breaking down protein. And that's one of the real important things when we're doing assessment, when we're trying to keep people well, especially during cancer treatments. So I think that's, does that kind of touch on it? The other thing we know that some of the foods, and it says foods to avoid, if you're having symptoms of diarrhea, things that increase diarrhea are sometimes the roughages that we use in the fibers. So there's 2 types of fibers, and one of them is called insoluble fibers. These fibers are not digested, and they are going to build up part of your bulk of your stool, and they're going to carry the food out. And sometimes this can be very irritating to the GI tract of people that are having multiple stools a day. So we try to increase the soluble fibers, the second type of fiber, which is the insides of the fruits and vegetables. It's kind of the pulp. So we try to get, many times we tell people to avoid the skins on the fruits and vegetables, peel them or cook the fruits and vegetables to break down the fiber in them better, or, peel them, take the seeds out. Some things you may not digest as well. So sometimes the deep green vegetables that we think of are real healthy, and spinach and things in the raw state, they may actually increase your diarrhea. So although we think things are healthy in our minds, if your body does not absorb it well, or can break it down, then these foods are the foods that we choose to avoid. And that's usually done by either kind of keeping food diaries so we can track what you're having trouble with, and working with, when you can, get to somebody to help you manage it, and a dietitian. This will really help you as well. Does that help us? Does that get through that one for us?
That does, and I highlighted the questions on nuts and seeds. The almond, pumpkin, peanuts. How many?
Well, and these are something.
Are there any drawbacks?
Okay, well, some of the things. Let's start with the nuts and seeds. For the most part, we really encourage nuts in just general wellness because they provide an anti-inflammatory effect, and this can be beneficial for health. If your body does, we just said, if you don't have a way to be able to chew these to the point where they're really soft and chew it, or you can put them in blenders and make, we call nut butters, cashew butters, and we talk about peanut butter. Now we're going to talk about peanut butter in a minute, but the rest of the nuts that were discussed here, almonds in particular, are very high in magnesium. And this is something that's very important to our bodies and our systems, and provide a lot of important functions in our body. So encouraging nuts and getting the magnesium, again, is plant-based. So some of it's going to depend on how many stools you're having a day and how your tolerance is. Now, peanuts have now remember, peanuts are different than most of the other nuts because they come in kind of a soft shell, and they're easy to contaminate. And there's some of the concerns with the fungus that gets on peanuts, and that may be contributing to some carcinogenic mechanisms. So there is some literature that it does bring some concerns to storage of peanuts, sources of, how long is shelf life, but that's mostly related. A lot of that's related to the fungus that's involved in it. Peanuts have come under scrutiny over time. And at one time, and of course, I've been doing this a long time, and it was something that I really, because it's a good protein, good carbohydrate source, and I use it in meal plans for treatment. With some of the research that's out, I look at it, I try to make sure that, I need the source, and is the source good, and, a little bit more careful with it than I probably was at one time in recommendations. But for the most part, nuts, seeds, pumpkin, of course, you're going to have to, break down pumpkins some more than just the hard pieces. But these things some of them, like sunflowers, are oil-based. So even though they're healthy, if you ate too many of them, you may have some fat malabsorption from them. So because they're fatty sources of foods to some point. Remember, fats have their oils in them, and some of them can be pressed so that we can get real oils out of pretty easy. So that being said, when we can get them and they're consumed easily, and you're not having trouble with the diarrhea behind them, going back to the serving size, it's a handful. It's about a handful, about an ounce of we say we need people to eat at least 6 almonds a day for their magnesium in some of the hypertensive studies. About 6 to a dozen almonds a day, when you can get them in, is a good thing. And I use your almond butters and things like that.
So I haven't seen this question done or asked in
This
this
one was
way.
interesting, and I actually looked it up. I mean, I was trying to look it up, and I still have not gotten a real clean answer on this. And I'm going to keep looking up because I haven't had this question before. But what I can tell you is that I use beef broth and bone broth with residents that are having trouble just getting nutrients in, and sometimes they can sip on these things during treatments, and they settle their stomachs, and they can stay with them. So, I've never considered it as a concern, for my red meat consumption. But yes, it's going to have some of the components of red meat. Is what it is. The I think the way we use it, it's probably not going to what we get, and even red meat. So look at it's go back to some of the concerns with red meat can be how we're cooking it, how it's prepared, and the temperatures. Is it like we talked about before? Is it cooked at too high temperature? Is it grilled straight over the flames and things like that? And then sometimes the seasoning that we use with meats can concern us some. And symptoms, we talked about MSG before, and sometimes you'll get into symptoms for that with the bone broths and things like that. So that, but I'm gonna keep looking. I'm gonna get to the answer of this. But should we try to limit our red meats? We do try to keep red meats down
But
to
I
about.
usually think about that with the saturated fats or the
Yeah,
fats,
yeah.
and
So
most of these bone broths are already skimmed of their fat. So
they are that's true. So some of the saturated fat we bring down for sure.
yeah,
Some
it's the
of
sodium that gets
some
strained.
of the cooking things we probably, because these are probably cooked slow and low, because that's how we do, to get the bone broken down or roasted slow. The recommendation on red meat, and red meat considers pork and beef, lamb as well. And it's 15 to 18 ounces a day by the American Institute of Cancer Research. And they really watch the cancer risk probably as well as anybody. And if y'all haven't used that resource, it is a good one. Let me say it again. It's the American Cancer Institute of Research Institute. Make sure I'm saying that. Institute. American Institute of Cancer Research, AICR, American Institute of Cancer Research. And it's a good source, and they've probably done is probably one of the best jobs of bringing the foods and the risk into researchable information. And I use those as a resource. So so the bone broth, so keep your red meats somewhat limited. Again, I'd have to say if it's during treatment, I'd really want to see what you're consuming and what your primary foods are. I wouldn't want to change if that's one of your primary and you're eating it at a high level and I need the calories and the protein. I would adapt that slowly. So, but again, so you may have dietitians recommending more this and that. So remember, everybody's an individual, and this is just a general statement. So.
I put up the AICR.org website.
Oh, good. Thank you.
Scroll things, so you can. Those of you who are watching or watching later can take a look at that. And working a little bit through. I mean, I think we've touched on this already, but understanding vegetarian with chronic diarrhea and constipation. Which are flip sides. So, foods that can help with GI or other supplements, whether it's Creon or
it can, and sometimes,
other...
and they didn't say here, so I can't necessarily assume, but many times when we were treating these net tumors, there's surgeries involved, and sometimes the surgeries involved include removing your gallbladder. So the gallbladder removal can increase the symptoms of both diarrhea and constipation in patients. And so bringing that back into concern. So that may be part of what you're seeing with symptoms, or some people may, if it's not you, some people may see the symptoms be related to the actual surgery. Sometimes that you have had part of your small bowel removed. or organs shortened or moved, and these can cause these symptoms. And we would adjust your diet to those symptoms and try to get in foods. Now, as far as being a vegetarian, we talked about plant-based being helpful. It'll go through the same thing. Sometimes we need more soluble fiber, even for people with constipation, because it tends to build the bulk of the stool. It can hold fluids in that stool, and that's the inside of the fruits and vegetables. Even beans. There's some beans that tend to irritate, black beans, red beans, pintos. Those probably are going to do better. Limas, some of the hard, what we used to call dried beans and peas, they'll do better if you soak them and pre-boil them for 10 minutes or so, and then let them sit for an hour. Rinse them, and it'll improve some of the tolerance and get some of the things that we're concerned about out. And it'll help break those things down. Sometimes with some of your vegetables, if you've been consuming the broccoli and cauliflower and Brussels sprouts, which can be healthy, but in a GI tract that's not functioning quite well and having these symptoms, those cruciferous vegetables is the class that they come in, and many times they're going to cause the gas, and that gas can increase both this problem that you're having in the GI tract with diarrhea, in particular, but also cramping with constipation with no results. So we can work out plans. There are many plant-based foods that can really be really helpful and good from a lot of sources. Carrots, sweet potatoes, and if you take out the real fibrous parts, can be good. Sometimes we have to use food. Well, I use white potatoes quite often. They get a bad rap, but they're very helpful in patients, especially coming off of surgeries. With the exception, I take the skins, have them take skins off of those. But for the most part, that's something that you can tolerate well. Sometimes we need these grains and these pastas, easy to digest foods. And again, we watch our amounts, and sometimes we add it. If you're not getting enough calories, we may split your meal plans into from 2 to 3 to 5 to 6 small feedings in order for you to get your calories in a day. So the vegetarian diets will go along with that. Winter squash tends to work real well in vegetarians with neuroendocrine tumor symptoms. Excuse me. And so, and also, if vegetarians, depend on the degree. I mean, are you still doing eggs? And we know with neuroendocrine patients, sometimes the white, the yolk has the fat. And again, fat is harder, can be the problems with digestion and other things that we're concerned with. So egg whites, if you're still eating those, are you doing dairy? Some of these things are things we'll also look for, but they can definitely, we can manage vegetarianism fairly well. There's always concerns and nutrients with any restrictive diet. So with that being said, I think those we really want to look at the overall intake. You may need the help of a dietitian and some suggestions on these. All right.
I'll let you cough there and take some tea.
Yep.
So really the last 3 questions are somewhat versions of the same thing, different ways. Are there anti-cancer diets? Is there ways to use diet to slow cancer growth? And then what's funny is this is one that I sent you.
And I'm interested. That was great.
We can talk about that as well. But intermittent fasting.
We'll just start with the anti-cancer diets. I've seen these through the years. I've been doing this a long time, and I'm getting old. So through, I've been practicing in oncology since I was 25, and I'm 64. So over 40 years, there's been quite a few, many different anti-diet cancer diets. I mean, that became, and it's been some of these are faddish and put you at high risk. And some of the things that you'll hear, people, they want you to do and buy. Anytime somebody wants to buy you something, you to pay for it, and it's going to make you better, should be a red flag for one thing. Because we really don't need those kind of things. There's no, for diet, we can use natural sources for nearly everything we're doing. Now, the alkaline question, we don't follow that. And I've had doctors for many, many years that have lectured with me in this area to explain that, the body's a one fantastic thing, and it's going to accommodate for most of this. So there's other things we worry about, and alkalines and kidney stones, different things like that. So we really don't follow that. Juices. Remember we talk about, well, maybe we hadn't talked about some of the concerns with the sugars and the juices is really related to glucose control and risk for diabetes, in which diabetes can increase risk of certain cancers, quite a few cancers, and not necessarily neuroendocrine tumors, but breast, colon, uterine. Some of these are very related to the obesity factor. So some of what we see is it's not a direct sugar interaction, but it's indirect. And there's quite a few indirect concerns with the use of sugars. And if those juices are going to increase that concentrated sweet, they come under that as well. In moderation, I think everything's accepted. So I don't see, and in practice over the years, the problems that we have with sugar is really the diarrhea effect, the cause of a dumping type syndrome from things, high concentration of high osmolality, high concentration in the GI tract that causes a sudden rush of fluids, and that's going to just go through your system. And we call that in somebody that's it had a stomach resection, we call that a dumping syndrome. In us, they don't use that quite. I call it rapid transit because it really does. It just increases the transit time of your GI tract. That's going to increase diarrhea. So some of it for the juices and the sugars are more concerned with the intolerance that we may have to those concentrations and increase of diarrhea. And so that you'll see those taken out in some of the literature that I even provided through the years. Really related to this fact, though, it's the intolerance to do it and not cancer growth.
And also, I mean, we talked a little bit about the difference, that cells actually need glucose and sugar, but that, the challenge here is do you limit the added sugars, the sugars that are naturally occurring versus the sugars you're adding?
And that's something we're trying to get all Americans to do. The recommendation for these have come down over the years to where we're really trying to limit everybody's excess use of sugars and sugary drinks. We don't need the excess calories from it. And we definitely are concerned about the glucose control and glycogen and some of the releases of other enzymes and hormones that are associated with that too. Insulin-like growth factor being one. So we are concerned with the overall consumption of added sugars for the American diet overall. So we're no exception to that, especially for long-term maintenance. And we're trying to avoid obesity and people that are long-term survivors and doing well. And patients that are having treatment issues or having diarrhea, again, it's a different reason, but we may still be just as concerned about the timing of it and the use of them and the amounts. Usually you can tolerate up to about 4 ounces at a time and slow sips in over 30 minutes. So that's kind of a guideline for those that are using the juices and having problems with tolerance. All right, here's our next one. Does that help? Does that get it there, Josh?
That sounds good.
Okay,
so let's talk another net website, but are there diets that slow cancer growth?
I don't know that. I don't know of them. I mean, I think that we would like to suggest some things that are slow in growth, but I don't think we know that. I think that it depends on treatment and things like that, and restriction of different foods through the years. And veterinary medicine shows that you know things like that, and other studies of animals and insects show that there is some, if you restrict things enough, you might get some negative, some negative tumor growth. But we don't like to do those things on humans. And the studies just aren't there, really to totally eliminate any one food group necessarily, except for those foods we were talking about before. We know that we don't want to increase the risk in tumor growth. So avoiding those foods that we know have carcinogens in it, I think that's the best practice probably. Now for the digestive systems, we've talked about those really today. Concentrated sweets, insoluble fibers, fats, high fat foods, foods that are very gristly and hard to break down are going to be harder to digest. So those things can increase your problems and symptoms. So we tend to recommend lean meats, more soluble fibers. Avoid those seeds and skins on foods when your diarrhea or problems with your GI tract is an issue. Keep water, drink water, stay hydrated. I think that hydration is underestimated and under discussed. So never underestimate the importance of sipping fluids throughout the day, low calorie as you can. We didn't talk about caffeine. Some people, the tolerance on caffeine is out there, but one thing we don't encourage are the energy drinks because this concentration of caffeine probably can be troublesome to the GI tract. As well as some of it's mixed with sugar, which we already know that we want to keep that concentration sugar. And if you're looking at a label, we try to keep it less than 12 grams of sugars per serving. So it's usually about a half a cup of juice at a time. And again, I think for patients that are having issues, we try to mix that with water or spritz or something and sip it over a longer period of time. So okay, this intermittent diet.
Before you get there,
okay.
Speaking about fluids,
yes.
What should we be shooting for in fluids?
Still the 6. When I'm doing an assessment, I'm going to give you the exact numbers that I'm looking for. If I'm going to base it on your kilogram of body weight. So if I take your body weight and divide it by 2.2, that gives me a kilogram. And for normal individuals, we multiply that times 30 cc's times your kilogram body weight. And it's going to give us a pretty good lead of where you need. So most people need around at least 2 liters, unless there's a reason for a restriction. That could be cardiac reasons, renal reasons, where we're having to restrict it because you have edema or you just body cannot get rid of the fluids in your organs. So, but other than that, we really try to increase fluids. We know fluid boluses sometimes are not tolerated well. So sitting and drinking an 8-ounce glass of water may increase your symptoms. But if you take that 8 ounces and you spread it over a longer period of time and sip slower, and also watch the temperatures. We know that ice can cramp your GI tract, and that can cause you to have a little bit more problems with it. And that room temperature water is really absorbed a little bit better for many people. But fluids can be gained by other sources, soups, some fruits can add some fluid. Food in general can add some fluid to your diet. But we try the recommendation still holds at 6 to 8 glasses of water a day. Again, I'd have to look at your symptoms. Some people, if the diarrhea output's too high, we may restrict their fluids some as well. Depending on their output and depending on their diagnosis. And Josh knows all about this because if we're putting out more and we can't keep the hydration, sometimes we have to go to an IV source to do that as well. So, all right. So what's my opinion on the intermittent fasting diets with NETs? What I'm going to say is that there's not enough research to give you an answer to this use in NETs. In neuroendocrine tumors, we don't want you to lose protein, and we want to maintain a protein balance. Anytime we do these intermittent diets, there's a chance that, especially in people in treatment and in anybody that fasts for a long time, we know your body changes the substrates that the energy source, whether it be carbohydrates, it changes that to burn more fats. When they wrote these things for this intermittent diet, and it's become, this is all kind of new. I learned a little bit. I learned a lot yesterday, mostly about the media background behind it. But this is being encouraged by some people in the celebrity groups for people without treatment. Okay, let's talk about that. Just general people, okay, no cancer involved. And they're doing it for weight loss reasons. And interesting enough, and there was a couple of facilities, University of Alabama and one other university that really did the studies, and they did metabolic cart readings, check the substrates. So you can put a mask on individual or hood on individuals, and after they eat, and then when they breathe, we can measure the amount of carbohydrates that they're burning and fats and protein, and we can tell, kind of what they're burning. And we know in intermediate that you may burn a higher percentage of fats when you have a long fasting. And they really were talking about a 16-hour fasting. Some of them were doing an 18-hour. So that means that they were getting all their calories in about 8 hours. And then they don't eat beyond that. And what the research really, really showed was that if you only eat during that 8 hours period, you tend not to consume as many calories in a day as if you're eating all day long, for one thing, or even depending on the length of the fast. So it didn't sound like real magic. It showed success in the short terms because people lost weight, because you cut something out, whether it be you fast them till they kicked in some fat mechanism burning, or whether you just restricted the calories enough where we know that they're going to also burn these other sources and they're going to lose weight. Do I like it in cancer patients? The example they use, and interesting enough, and it's been years ago now, because I was in practice with a specialist that's well known in this area, and they were just putting these breast cancer studies together with the use of the intermittent fasting. But all these studies were done in conjunction with chemotherapy, and the purpose of the intermittent fast was to open up some cell sites that it showed that the chemo was able to get to these cells a little bit better by using some of this intermittent fasting prior to the chemotherapy being given. And I think it did show some results, positive results, and there may be this may be used in some of the recommendations, but those studies were really wrapped around breast cancer, where it's a hormone. These are very different. And it has a lot more of a hormone effect with breast cancers, and obesity sometimes is a problem with breast cancer as well. So, but anything that you do that's intermittent with your diet needs to be done under direct supervision of a physician or a practitioner. You should never do any of these really just on your own, because you still need to get a balanced diet within these fasting periods. And I don't believe getting real high calorie amounts in this period is of any benefit versus, the calories in 8 hours, if you still got the same amount, would probably do the same thing as spreading them out all day. So, so it can be, lose some weight. So the offset, and this is interesting because they say, my husband will tell you, I get hangry. I am a hangry kind of person. I tend to have a little and pass this on to my children. I have one child that's actually insulin dependent diabetic, but my other child and myself are really reactive hypoglycemics. She's much more severe. But even anybody, if we get to fasting and you don't feed yourself, especially at first. And it was really interesting when I was listening to the young lady that had done the study, and she, with the first day, she was hungry and she was angry and she was tired. It does cause you. So what happens is when you do that and you fast over a long period, your blood sugars are going to come down lower. And when your blood sugars come down, you get fatigue and you get hungry and you get these symptoms of moodier, and you don't have the serotonin release to make you happy. So some people that do this long period may not have, may have an effect on their moods. Some can really have these what I say hunger, angry effects. But it's and related to low blood sugars for the most part. Sometimes your bodies will adjust to it over time for the most people. I don't think it's always easy, but as far as if you're someone that um, gets those low blood sugars, you really need to feed them, over time with not these sugars and high boluses or anything, but some protein and lean meats and whole grains. And I think it did bring in the importance of the whole grains and use of really a overall healthy, lean meats, low fat, fairly low sodium. Now the recommendation for sodiums have dropped extremely low, which makes it extremely hard in the South where we have a very high sodium content. But we're not very affected by sodium in this arena, except for hydration. And that's always an issue, especially here in the summer months. So
And
I'm out on the fasting thing. I think that if I was doing weight loss only and it was not or if I had to do something with a patient that was long-term and not in the middle of treatment, and a physician addressed this with me to try to use it with a resident, a patient, I would attempt it with them with the control of a physician, because there's things I'd want to watch, especially glucose control and how low those blood sugars over time are falling. Again, I think, and I've seen a lot of things come and go. I mean, over this time, I have seen many fads, many diets come and go. If this research stays sound with the use in chemotherapy and under control and treatment for specific periods of time, this research may continue to show some success. So we'll watch it. It's still out.
At the bottom of the screen, this is the podcast from Spotify. There's a Science Versus podcast, and they did a whole episode on intermittent fasting. The first half of the episode is on weight loss. The second half is on health and health concerns, and much about the study that you talked about with breast cancer, but also some of the other challenges that can happen with long-term use, whether it's gallstones and or other heart conditions that may occur with it.
Yes, remember that. That's really important what you just said. Gallbladders over many decades now, we know that if you fast, these old fast and low calorie diets from way back in the 80s caused more problems with gallbladders than it did anything else. So anytime you restrict and you do these special diets, your gallbladder may actually have some real complications. So yes, that's always a concern. We don't want you to break down muscle. Remember, your organs are muscles. So, you don't want to break down your heart muscles. You don't want to involve your livers and your other organs. So I don't do special diets during chemo treatments. I just don't at all, unless I have a specific reason, and it would be under a physician's control. I do meal plans individually, or kind of, as I speak in this, I want wellness. And so I don't usually grab onto these individual, control restrictive diets.
So there's about 147 references that are part of the show notes to this, because it was one of their most referenced or a episode that took the most number of references for fact checking. So it's worth it just for job. Yeah. It's a very interesting. Very good. It's an interesting 45-minute thing as well. And we also have this, whether it's intermittent fasting prior to therapy, but also the question about antioxidants prior to therapy. Again, one of those things that was actually done in breast cancer and turned out not to be a positive study. That's right. That antioxidants actually went against the chemotherapy because it was trying to repair cells that
we're trying to go down. And I've had that question for years. My oncologist not wanting me to boost, when they're trying to reduce. So we have to be real careful when we're doing these things. And what it said is basically, this is no miracle. It's not a miracle cure, this intermediate and change on oncology. And before we finish, I think that the take home on many of the things that we've discussed today is is the moderation. Everything in moderation. Overconsumption of any nutrients or any one food's area can be problematic. It's like overconsuming eggs, but we know that we've reduced. There was a question on some of this stuff today on the prostate question, prostate and use of certain foods, and that was related to choline. The choline in the eggs is the concern with carcinogenic for prostate, and it's in the yolk of the eggs. It's in organ meats. It's in some plant forms. Recommendation is 550 milligrams a day. It's an essential nutrient. We have to get it from our diet for the most part. And there's good sources, but again, we don't want people to overconsume. So the recommendation stays a lot like the recommendation for heart disease and other things, where we recommend about 2 whole eggs a week and allow the egg whites to be consumed at greater amounts. That's kind of where that one went.
So I know your grandkids are.
They have already they're high tech, and I'm not. So they've already got my credit card and have gotten their food delivered from what is it?
Grandkids?
My grandkids.
Grubhub or...
Yeah, I'm an old grandma. I've got one that's 13 and one that's 11. I have 6 of them. I have them from 1 year, 2 years up. But the ones I have now know how to spend their money. So we have DoorDash. So DoorDash has already come and fed my grandkids. So we're learning a lot. We're learning a lot.
Again, we put, if you just want to send an email to info@norcalcarcinet.org to suggest ideas for our month of August Nutrition Friday.
Tell me what you want. There's some interesting topics. We're getting into some interesting times, and we can talk more about different foods. There were some GI questions we didn't get in today with, kind of goes back to what we had talked about with using probiotics. And there were some things on some questions that I probably could have gone that way, but I think that's also interesting. And we've touched on that. So just let us know what you're interested in. I'm trying to keep this current, as current with current ideas and current information. So just let us know what you're interested in. I appreciate y'all having me. I always enjoy this.
All right. Well, enjoy your grandkids, and I look forward to talking with you next month. So,
all right. Sounds great. Sounds great.
Right.
Thank you.